We're doing the influenza A virus by Cade, and Colton. And some background history about the influenza A virus is that it is a contagious respiratory illness that is caused by influenza viruses that infect the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. Influenza was discovered not by a direct study of the disease in humans, but rather from studies of animal diseases. It originates from animals such as pigs. New viral strains of influenza come to this country and Europe from Southeast Asia. It was believed to be the same disease as the now famous Spanish influenza pandemic of 1918. Influenza, or the so-called Spanish flu pandemic, was affected 1/3 of the world's population and killed 50 million people. Some geographical history about influenza A virus is that there is a low activity for the flu in the temperate regions of the northern hemisphere, but increasing in the North America and most of Europe. A few countries of southern Europe appear to have now peaked, along with the countries of northern Africa and the Middle East. The influenza virus lasts from October to May in the northern hemisphere and April to September in the southern hemisphere.
I'm going to be talking about the pathogenesis and viral genetic material. The influenza virus causes an infection in the respiratory tract, or the nose, throat, and lungs. The virus is inhaled or transmitted usually through fingers to the mucous membranes of the mouth, nose, or eyes. Then it travels down the respiratory tract and blinds the epithelial cells lining the lung airways by specific molecules on the cell surface. Once it's inside the cells, the virus hijacks the protein manufacturing machinery of the cell to generate its own viral proteins and create more of it. So once the mature viral particles are produced, they go away from the cell, and then they can go on to invade adjacent cells. The influenza is a RNA virus. And some symptoms of the flu are some pain in the muscles, a cough that can be dry. You'll get chills, you'll be dehydrated, you'll be fatigued, you'll have fever, body aches, and a lot of sweating. You'll also have some nasal congestion, a runny nose, and sneezing. And then also chest pressure is pretty common, head congestion, headache, nausea, and shortness of breath.
Alright, so I'm going to be talking about the last part of our presentation, and who is most likely to get infected by the flu. Children younger than 5, but especially younger than 2. Adults 65 years of age or older. Pregnant women, residents of nursing homes and long-time care facilities. Also American natives and Alaskan natives. There were 56,000 deaths due to the flu. In 2013, the rate increased to 9%, but now has decreased to 3.8%. Now how to prevent the flu. Clean your hands with soap and warm water for 15 seconds. Cover your nose and mouth while sneezing and coughing. Avoid close contact. And most of all, get a flu shot. Thank you. This was a presentation by Cade, Colton, and Case. And stay curious.